Greetings. I am Michael Matthews. I am your moderator for this episode of Our Stories, Our Healing. It is a pleasure for me today to be joined by City of Cleveland Council President Blaine Griffin. He and I have known each other for over 20 years. So I enjoy his company. I enjoy his experience. He has always been a mentor and a guide for me. So having the ability to share this space with him today is going to be one of the joys that will begin 2022 for me. We always open it kind of with the disclaimer. We're going to be talking about some very serious issues today. So if there are things that spark you, please understand that there are resources available. Topics we'll be discussing today are witnessing violent crimes and also talking about violence reduction, which I know has kind of been a core principle of his work in the community. And we both have personal and professional experiences dealing with both. So how are you doing, Council President?
I'm doing good. How you doing, Mr. Matthews? It is so great to see you. We're here in Cleveland, staying warm.
Absolutely. That should be the motto for Cleveland. So we'll just ask one, introduce yourself. I've already kind of given you a title, but please introduce yourself and kind of where you see like your perspective and how kind of your position is from a public health perspective in terms of violent crime, violence, and kind of where you stand.
So, I'm Blaine Griffin. I am the Cleveland City Council President. Before then, I was the council person for Ward 6. I'm still the council person for Ward 6. We elect our council president amongst our peers. So I do hold both of those titles, Ward 6 councilman and president of Cleveland City Council. I previously, before that, was director of the Community Relations Board with Frank G. Jackson. But my whole career started, as we talked to Mike earlier, in community organizing and really addressing root causes of health, just a Cleveland guy. My wife and I have raised our children here in the Buckeye Shaker Woodland Hills community, and that's who I
am. So tell me, how do you see the progression of kind of supports to reduce violence in the city of Cleveland?
I think that there are a lot of multifaceted efforts. However, I think that there needs to be more coordination, and there also needs to be more done to address some of the root causes of the social determinants of health, which is why violence, in my opinion, is a public health crisis. And I think if we look at it from that lens, then we can really try to, build the collaborative efforts that we need in order to address it.
And then from your position, can you talk more about like policy? Like how do you see policy changes or things that need to be done to support those changes?
Several different ways. I mean, we did a lot of things when I was in the Community Relations Board to really try to engage violence interrupters. We created a network called the Peacemakers Alliance, which were activists that were on the front line who were indigenous leadership, people who were authentic to the community and people who really understood the community in a very special way. And then also some formerly incarcerated individuals and clergy members and others to really try to get the message out and penetrate the community in a very special way. We also have done some very unique strategic things to really isolate and use data to determine that, at times there's a small percentage, almost less than 10% of our community that can be linked to, some of the violent crime in our community. So when you understand the data and the statistics, it helps you formulate policy. So we've actually done a lot of policy and really to try to, do things like, put more money into trauma centers. With council, you actually have a couple of different things. You have you control the budget, which is where we're in now. So we can put money towards what we think is important. And number two, we create policy, write laws and legislate. And then number three, oversight. So I'll just say that we put a lot of money into Peacemakers Alliance by making sure that we have money in order to help with that. We put a lot of money into, trauma-informed care at our rec centers, so that we could deal with trauma and make sure that we have life coaches and other things like that in our rec centers, change the way that we do business there. We put a lot of money into the police department in order to try to have a social service component, in order to deal with victims of crime and people who've witnessed crime and other things. But then we've also did some policy initiatives, like trying to make sure that we work on decriminalizing marijuana. Now you're saying, what does that have to do with violence? I mean, if you try to stop the cycle of how people move into the system, those are the kind of things that we try to do and really try to push people more towards treatment and those kind of things, as opposed to incarceration, which oftentimes lead people into a cycle of violence. So the other thing is really working closely for oversight to make sure that we change the way that we do business in the city of Cleveland. So those are a few things that we looked at. But once again, your budget reflects your values. And that's what we really have done, put a lot of money towards violence as a public health crisis.
I remember working with you a lot, looking at the data and kind of identifying the hot spots in kind of the city of Cleveland. Are you still seeing kind of differences between violent interactions, west side, east side, near east, or those things kind of developed to where now there are more newer things that are developing? Or is it the same type of cycle of the same things that we've seen over the years?
It's like the same things that you see over the years, and Cleveland has a crescent that starts in the far northeast side. It goes throughout most of the east side. It goes to the near west side, and then it comes back over to the central and southeast parts of town. And in those areas, in that crescent, all of the social determinants of health are prevalent. High infant mortality, and it happens to be large BIPOC, Black, Indigenous, people of color. But it really has all of those determinants: high lead exposure, low educational attainment, and yes, violent crime. So yes, those areas are where we're seeing a lot of the trends. But there are also some emerging trends where we see in some other areas that are starting to see upticks in violence, even in some of the inner ring suburbs that have seen some of the highest rates of violence in years.
Wow. So I know a lot is done to kind of prevent it. Kind of what can you offer to people to kind of help them as they go through those different traumatic experiences? I know we often see kind of the vigils where people have like the candles when things are out. I know recently, I believe there was something that were being kind of addressing that, but kind of what can people do to help kind of alleviate that trauma and be able to continue to move forward with positive energy, positive thoughts, and not look negatively upon the city of Cleveland kind of as the cause of those things?
Well, I mean, it's not a perfect answer to that question, because people have to do what they feel comfortable in doing. Everybody cannot do everything. So the first thing everybody has to do is see where they can contribute, but everybody can contribute. So just a few things that I could tell you is that when you look at, how you can embrace young people, you have to stop looking at them like they are the villains. You have to start looking at them like they're your own children. I think we've done a horrible job of labeling young people, especially young people in our community, that all of these guys that you see are not violent, because you actually help perpetuate that. Language is important. I do not use the word gang. I don't use that. I use group member involved individuals. And the reason that I do that is because when you label folks, you create that false legendary status, so really be careful of doing those kind of things. I think you also need to really be visible and active in your community. We don't engage each other as much as we used to. So those are things that we should do as well.
As we close up our time, is there anything else that you'd like to share, add, kind of from perspective, personal experience, anything involving the topic around kind of witnessing violent crime and violence reduction?
Well, I've unfortunately, somebody asked me what was the worst thing that I've experienced when I've been in public service. And I would tell you that the worst thing that you can witness is when children and adults, quite frankly, witness violence. We have a lot of our community that have, adverse childhood experiences. A lot of our community has been dealing with trauma. So if you go into the average room and you tell everyone to raise their hand, they will tell you that and say who has witnessed a crime, or who has witnessed someone getting shot, or who knows someone who has been shot, or who knows someone who's been killed. I would tell you that almost all of the room will raise their hands. I think violence is a public health crisis. I think we need to look at it just like we do any virus. You have to identify where it started. You have to isolate it. And then you have to inoculate the rest of the community from being exposed to it. So I really think that we really should, relook at how we view public safety. I will also tell you that, data does not lie. And we know, the loss production and all of the other things that come with violence. So we have to do a better job of educating our community and our public on this. And we're not going to arrest our way out of this. So we have to look at this and take a different approach to violence in our city.
Thank you, Council President. This has been awesome. For everyone that has been listening, hopefully he's been able to inspire some thought, inspire some change. Inspire you individually to take part in community to help reduce violence. Our next episode will be March 25th, and it's kind of a linked subject. We'll be talking about children that are growing up with incarcerated parents. So that's a whole different kind of additional perspective on kind of what happens when we continue the cycle of violence in our community. So we wish everybody a great day. Again, thank you. And definitely we look forward to seeing you on March 25th.